Rosie, I just wondered if you would like to share your slides while I start with a karakia. Whakataka te hau ki te uru, whakataka te hau ki te tonga, kia mākina kina ki uta, kia mātaratara ki tai. E hi ake ana te atakura, he tio, he huka, he ho hu, tihe Māori ora. Thank you, Rosie. If you just want to move to the next slide, and I'll do a little introduction of the Lunch and Learn, which is run by the Paediatric Society. So the Paediatric Society is open to everybody, and we'd be more than happy for anybody else to
just hang on a minute. Oh yeah,
there you go. Well done. So it's professionals, and we're working to support the health and well-being of children, tamariki, and young people in rangatahi throughout Aotearoa, New Zealand. This Lunch and Learn is supported by the Child and Youth National Clinical Network. The other wonderful thing about joining the Paediatric Society, apart from networking with loads of other people who've got the same passion and interest as us, is education grants for all members. Today we are, you can go to your next slide if you want, Rosie. We are very lucky to be having Dr. Rosemary Marks, paediatrician, retired paediatrician, who is presenting to us Storming the Bastille, Breaking Down Barriers to Equity for Tamariki with Down Syndrome. Just a little bit of a background on Rosie. So Rosie trained in paediatrics in Auckland and the UK and has worked in developmental paeds since 1982. And since 2020, she has led the Down Syndrome Clinical Guidance Workstream, supporting the development of accessible, high-quality information for health professionals working with children and young people with Down syndrome. We're going to hear some of that work today, and if you joined us last month, you would have heard some of the work from the allied health professionals who have done some of the working on the literature reviews to help Rosie with the development of the Down syndrome guidelines or guidance principles. Anyway, we are very, very grateful to have you present to us today, Rosie, so take it away. Thank you.
Thank you, Jane. Okay, Storming the Bastille, why? Well, I'll come to that in a little moment, but our goal has been to really break down the barriers to children and young people with Down syndrome in accessing healthcare and having health professionals who know what they need. So this is the group, and I think 2 or 3 of us are here today. Not everyone could make it. So the objectives for this presentation are firstly to give you a brief overview of the historical context and background to this, how we approached this mahi, and also, very importantly, where you are going to be able to find the information that we have produced. And most important of all, you will, after this presentation, we hope, resolve always to listen to the concerns and views of the tamariki, the rangatahi, and the whānau who are living with Down syndrome. I don't think I was very good at that when I was young, but I got better by being educated by the families that I worked with. So Storming the Bastille, on the 14th of July, 1789, the people of Paris stormed the big prison in the middle of Paris to get the weapons that were stored inside. They wanted to overthrow the tyrannical government, and I may be being a bit mean to some of my colleagues, but the medical profession has been somewhat of a bastion of keeping the information to its own and not sharing it. So this is about sharing. In terms of the historical context, in 1998, Dr. Warwick Smith, who some of you will know, who has been worked for a long time at the Counties Manukau as well as in private, started working on the first Down syndrome guideline. And I hope, if I hold this up, I don't know whether you can see, but oops-a-daisy, no good. That was it. It's only about it's only about 5 millimeters thick, and it's hard copy. Eventually, Warwick managed to persuade the Ministry of Health to publish it on their website, and there was a PDF copy available on the website for many years. That appeared in 2001, only 3 years after the card copy and the website, only 3 years after the work started. But, you know, good things take time. In 2013, there was a situation in Wellington where a young boy with Down syndrome died, and in fact was found to have got fulminating leukemia, which hadn't been recognized. And there was some suggestion about whether that could have been detected or not detected. But the coroner recommended a review of the existing guideline. In 2019, the clinical network was established, and in April 21, we all escaped from our bubbles and went to Christchurch for a meeting. And at that stage, the work stream was established. Since then, we have done all our work virtually, which has been good. So what's our purpose? Our purpose has been to provide up-to-date advice for health professionals on the best clinical management for tamariki and rangatahi with Down syndrome, in the context of respecting the knowledge that whānau have and the knowledge that people with Down syndrome have, and promoting shared decision-making. So not you will do this, although we are making some recommendations about what should be done on a regular basis, but for really to have shared decision-making. Our first efforts were probably a little, like as in many things, when you're learning to walk, you tend to fall over. There had been some previous work done. After the coroner's case, there was a registrar working in the Ministry of Health was given the job of updating the guideline and talking to lots of people. And that ended up in another big document, which was never actually published. Then in early 2000, a trainee intern was marooned in New Zealand. They were about to head off on their elective, and given that this trainee intern, who is now a paediatric registrar, or may even be a paediatrician by now, was the daughter of a paediatrician and was known to people and needed something to do, she and I met virtually and talked about how we could update it. And she talked to a lot of the specialists. But we've not published anything. We had not published anything, and all of that work had been done by medical professionals. In retrospect, what we should have done was to ask some questions. And the questions we should have asked were who needs this information? Is it paediatricians and paediatricians in training? Is it other health professionals working with tamariki with Down syndrome? Is it general practitioners? Or is it whānau and people with Down syndrome? And then, having asked those questions, where do we put the information? And then we needed to find and collate it. So we expanded our horizons, and you would have heard last week from the therapists on our team, last month, from the therapists on our team about the work which was done looking at what therapy interventions work. And that's the link, which you won't be writing down, to last month's presentation. We also got some feedback from parents of children with Down syndrome. So one of our members, Anna Latu, was on the Down syndrome parents Facebook page, and she posted some questions about what people wanted to know. And these are just 3 of the examples. And I'll read bits of them to you. I'd like to tell our paediatrician that my son is not deaf or stupid. She literally shouts at him. He's now 15. And when she's taking his blood pressure, she shouts, "It's getting squeezy. It's going to get squeezy. Is it squeezy yet?" He gets cross. I want GPs to know that Down syndrome DS children are not what they describe in the books. I want them to know they can understand what you are saying, just like any other kid. And one very positive comment, although Phil's name is spelt wrong, and this is a paediatrician, always used to ask for my advice. What do you think is wrong? So these were the people we agreed needed the information. So where does the information need? Which or Carty, I'm not sure which, will send round to everybody who is on the distribution list. So you will get that in another day or so. We've opted to put a lot of information on the Starship Guidelines site. The rationale for that, it's where paediatricians and paediatric trainees around New Zealand go for information. So it was widely used. It's also open access, so anyone can go on the Starship Guidelines site, including parents. Absolutely anyone. General practitioners need information. We published a how to treat article in a magazine called New Zealand Doctor, which is funded by drug companies, but goes to all primary care providers throughout the country, I think every week. We're going to liaise with Health Pathways when we've finished our work to try and get this also into the GP, the internet-based GP information. And with Catherine's help, we have the Kids Health website has now got some information about Down syndrome. Excuse me. And I'm very pleased to say that within the last week, I think, Catherine, or the last 2 weeks, we now have a New Zealand-based video, which Anna Latu and her daughter and a friend of hers, we have that on the Kids Health website. So do go and have a look, because it is voiced by an 8-year-old New Zealand boy with a New Zealand accent who has Down syndrome. And I think that's quite important. We've also done a couple of presentations in the past to the New Zealand Down Syndrome Association conferences, and we're just in the process of teeing up doing a session at their forthcoming conference, which is in October. We've also looked at Janine, who is one of our workstream members. Janine Thompson is going to talk at the paediatric conference, and we're looking at other options for operationalizing this so that the information is out there. So this is an example. So in terms of finding and collating the information, team members took responsibility for different subject matter areas. So as you know, the allied health members of the team took responsibility for looking at allied health. We consulted many subject matter specialists. Some of them needed a bit of a harassing, and I won't name names, but there are some people who it took me a year of nagging to get information from or to answer my questions. It was really rather tiresome. But anyway, we got there in the end and we have information. We reviewed literature, and we also looked at the some other major English language websites, the US, Australia, Canada, and the UK, which has a very active group, which I was once a member of, called the Down Syndrome medical interest group, and they have produced an awful lot of documentation on management of Down syndrome. Unfortunately, a lot of what they've produced runs to sort of 40 pages per topic, which most people may not have the patience or time to read. So this, if you go to the Starship Guidelines website, this is an example of what you will see. And this is this is the one for vision and eye health. I don't like this color. And I've had a little whinge about it, but nobody's actually taken any notice of me. After I retired, I did some work with the people at whānau, the Blends team. And this is, for people with a visual disability, this is awful because it is yellow on darker yellow. And so it's hard to read. So I'm quite sensitized to this thing. And I had a little tantrum, but I was told, sorry, this is how it is. This is the Clinical Networks one. But if other people want to have tantrums, please go right ahead. So this is what you see when you first get on the page, and it gives some information about the frequency of various vision problems in Down syndrome. And then it has the key recommendations, and there are 11 of these, which is rather a lot. Don't try and read it. You can go to the page if you want to read it. And then each piece of guidance we've produced also has a rationale for what we're recommending. We're also almost completed a ready reference section, and this is the heading for each one. So for all age groups, we encourage people to check the family whānau, child, young person concerns, to ask what their concerns are, to use respectful affirmative language, which I think is really important, to use Down syndrome specific growth charts to check growth. And I don't know whether there are any dietitians on board today, but there are two fairly good Down syndrome growth charts. One is the set that was developed by the Down syndrome medical interest group in the UK in conjunction with a company whose business is Growth Chart. Unfortunately, that costs, so you have to buy the license. As far as I know, the only region in New Zealand that has bought the license, and this was, of course, before we got reorganised or disorganised, is the Waikato. So if you're working in the Waikato, you can access these growth charts as part of the electronic growth record. The other where you can get free charts from is the Centers for Disease Control in the US have a series of growth charts. And also just to check, people should check for what concerns people have about general health issues, feeding and sleep. So the issues we're going to cover in the ready reference section include this list. I won't read it out to you. And they are in order. So the issues that you are likely to see, vision, immunizations, and then the softer stuff like behavior and psychiatric issues, which of course are very important to whānau, and support and community engagement. So it's not live yet, but this is what it's going to look like. So this is a screenshot of the first couple of items in the ready reference. And the goal has been to try and get it onto one page, because if it runs to 20 pages, people won't read it. So we have cardiac here at the top, because that's pretty important, and one of the first things we look for. Infant to 12 months, although we did have a column for newborns, and I'll come back to that in a minute. We don't have a column for newborns, and there's a reason for that. Preschool child, school-age child, and young person, because the issues obviously change as children grow and develop. This chart is from a paper in Pediatrics from the US. And if it looks familiar, it looks a bit like the chart we use for developmental, which I'm now forgetting the name of, but that doesn't really matter. But they've looked at developmental milestones for children with Down syndrome. We were hoping we could get permission to reproduce this chart on the Starship website, but unfortunately they wanted 400 Australian dollars for it. So we decided that was a bit steep, and we didn't have the money. So the paper is actually open access. So our section on development directs people to that paper. The newborn ready reference is work to be completed. There is on the Starship Guidelines site a newborn advice for Down syndrome, which has been prepared by the Neonatal Intensive Care Unit in Auckland. It's quite Auckland orientated, and we are obviously intending to help everybody throughout the country, and are actually in the process of arranging to meet with the chair of the newborn network and the facilitator for that network in the next couple of weeks to discuss with them whether we can actually produce something better. So there is information about newborns there. It's not information we've produced, and it probably doesn't tie quite with what we have produced. Oh, did I achieve the objectives for the presentation? You'll just have to tick these off quietly by yourself. So hopefully you know a bit more about the historical context and background. You've learned about our approach and the mistakes we made, because we did make mistakes. We barged on initially with trying to modify a document that already existed and then realized that wasn't going to work, and it certainly wasn't fit for purpose in the 21st century. You will know when you get the handout where to find information relevant to the clinical care of children and old and young people with Down syndrome. And you have resolved, and you probably have all resolved this anyway, I hope, always to listen to the concerns and views of tamariki, rangatahi, and whānau. And I just want to acknowledge that this was a work that a lot of people had input into. I can't name them all, but Colette and Denise, as the co-chairs, have been very helpful. Kati, who can't be with us today, it's school holidays, she's got something on, has been the facilitator for the last couple of years. There were previous facilitators, but she has done an amazing job in supporting us. The whole workstream team, Susan Cato Simons, who is the Starship website editor, and Catherine, who's online, and Greta from the Kids Health team, and all those many subject matter specialists from around Motu have contributed, and the families and the kids, and especially Anna, Georgia, and Arpi. So Georgia is Anna's daughter and helped hugely with the Kids Health video. Arpi is her son, and Miranda is Taonga's mum, and Taonga is the voice you will hear when you look at the video. There are lots of others too numerous to mention. So that's all I've got to say. So we have probably a few seconds for questions. Oh, and look what's coming. Yes. Mind the Gap, Allied Health Provision of Therapy in Neonatal Units. Probably good in some places, not so good in others.
Yes. Thank you so much, Rosie. Thank you so much, Rosie, for your taking us on your historical journey from 1998 to 2026. I've written 28 years from when Warwick did his first publication. That's 28 years. And I'd just like to give you a little encouragement, Rosie, about if you want to change the colour of the website, that doing that took 28 years. Maybe you just keep on persevering if you want to change the colour of the font, or like find someone to pass the baton to work on changing the colour. Just good things take time. My reflections, and people, please unmute yourself. And I'll just say this here. Yes, please note the change of date for next month's presentation, because if you've already saved it as a recurring thing in your calendar, next month, to accommodate Danielle's availability, it's a week earlier. So please make note of that. You'll obviously, if you're on the mailing list, you'll get a reminder, but put it in your calendar so you don't book anything else out. And Danielle did some work also under the network and some research about reviewing therapy, allied health provision in neonatal units in New Zealand. So very important work for all of us. And so we really welcome you to come along and to listen to Danielle.
And the knowledge translation session for that is also on a different date to our usual session as well. So we're really excited about having Danielle come and presenting. So yeah.
Thank you. So if those that don't know, that's Donna, who also, Donna and I are sort of the lead people, along with Catty and Lisa, who help run the Lunch and Learns. Just if you want to not stop share the screen, and so we have got a few minutes if people want to ask questions. I want to say something to you, Rosie, my things that I've taken away. Number one, listening to the voices of people with lived experience, whether they're the children and tamariki and rangatahi and whānau. Number two, I've written, bring people with you, because that's what you've done in this project, Rosie. And I think if that's a message to anybody that's joining here today, that's one of the things. But belonging to the Paediatric Society and belonging to the clinical network is that through the Paediatric Society, you can gain all these connections. And by being part of the Lunch and Learn, hopefully you're seeing that there's a community around the whole of New Zealand that you can tap into to help you on any project or journey that you're on. The third thing, I thought you said you made mistakes, but the thing I learned, what I heard from you, Rosie, it's about being flexible. So if you've made a mistake, it's not just keeping on going. You've learned something. And I think that whether it's a project about the Down syndrome guidelines, or whether it's just the work that we do every day with families, it's about being flexible and not being stuck on one path, but listen and be adaptable. And the third thing I wrote was persevere, because things take time. And those are all the messages from storming the Bastille, right? You have people with you, things take time, you do it together, and walls can drop down. Those are the things that I took away. If anybody else had any questions, please just unmute yourself if you've got a question for Rosie and the other people that were part of the team that have joined her here today. If those other people in the team, you want to turn your cameras on so we can see the faces of the people that have done this amazing work, we would love to congratulate you all, because Rosie's presenting on behalf of you. So if anyone has a question, please feel free to ask it now.
There's Marin and Heidi.
Yeah. Look, Donna's raised her hand. Off you go, Donna.
Look, I was being polite. Yeah, and again, apologies, I was slightly late. I'm teaching in the hospital this morning. So yeah, really interesting presentation, and well done to you and all your team. Rosie, you mentioned that quite a lot of the information and things was up on the Starship website, and also your colour challenges with the with the Paed Society. The information that went up on the website, was that stuff that you had input from whānau and people with lived experience, before it went up, or?
We have lived experience people on our work stream, so there is input from lived experience people. It's all quite sort of technical, because it needs to be brief, or people will ignore it. And I'm sorry, I grieve for the state of the health system and the pressure that people are being put under. And to digress slightly, one of our neighbours, I just heard the other day, he's been a consultant at a hospital in Auckland for some years, is currently on sick leave, and apparently is just lying there completely burnt out. I have a son who is a surgical trainee, and the shortages in his department in the hospital where he's working are awful, and they're at both senior level and junior level. And I know that in allied health and nursing and right across the system, we have a shortage of qualified health professionals. And one of the problems, I believe, is that we do not value each other enough. And we also need to hear from those in important positions, like government ministers, that they really do value the work that health professionals do. And sadly, that does mean money. But they also need to was spoken at in a way that was valuing. That would help.
Thank you, Rosie.
And I think one of the, I think one of the things as well in terms of that sharing with this process with the team, in terms of empowering family and not gatekeeping that information, and as well, that I think a lot of the time, sometimes as health professionals, we can be a bit like, oh, well, there's this, we can't do this, and this is our limitations. And if we're actually open and sharing information and sharing what is best practice and things with whānau, then that means it's not just our battle or as well. Yeah.
Thank you, Donna and Rosie. I guess we can all make some positive step towards improving things at election time as well, Rosie. But does anybody else have any question?
Well, I live in Epsom and I know who I won't be voting
yes.
for.
Oh, yes. Anyway, we're as health professionals, Simon has told us we're not allowed to say anything, so let's be careful. Catherine, do you have a question or something you would like to say?
Just very quickly, thanks so much, Rosie. When we were doing the kids' health content, it was so valuable having the lived experience input, because it meant that we kind of just turned around the language so that it was much less deficit and much more strengths-based. And I just don't know if we would have completely achieved that had we not had that input. So yeah, it was a great lesson for us.
And I know that, we're now just going over time, and I would like to finish with a karakia that for those people that may have just heard at the beginning, Rosie saying that there's going to be some people presenting at the Paediatric Society conference at the end of the year. And I know that one of the goals of the conference, I'm not going to say the right words, but is about lived experience. And certainly on the first day, which is, well, it's not the first day of the conference, but it's a satellite day at the beginning. Our network is running a satellite day, and we are trying to focus on lived experience. And there's an amazing mama who is going to be presenting at that. So if you're down in Wellington or you have capacity, it would be great for you, any of our attendees, to join us at the Paediatric Society Conference in Wellington at the end of the year. I'd like to finish by just saying, one, you've been very generous talking about your whole team, Rosie, but to have someone with your experience and your history leading this, you are, as a paediatrician, a wahine toa. So thank you very much for persevering with this work. And for sharing it with us, Rosie. So I'll just finish and close with a karakia. Unuhia, unuhia, unuhia ki te uru tapanui, kia wātia, kia mama te nāko, te tinana, te wairua e te ara tangata, koia rā e rongo, whakairea aki ki runga, kia tina, hui e taikie.
Taikie.
Thank you so much, everyone. I hope you have the rest of a wonderful week, and we look forward to seeing you in 3 weeks' time, not 4 weeks. Come back and join us then.